Hi everybody, I'm Parth's mother here, and actually I started off when he was in second standard, and when I woke him up, he just couldn't get up. He became later, and again his become body really stiff, and we were really scared what to do. So we had to rush him to the hospital in the morning. Then they gave some medicine, but then he was still not getting better. Then someone suggested Dr. Pradnya Gadgil. So we just went to her, and that was the time she gave the medicine and he was better. From that time our journey has started with Dr. Pradnya from when he was in second standard, and he has been under her medication for quite a long time, and he's been really progressing better, and there were no epilepsy seizures of it. And she was the person who diagnosed that he is having epilepsy. She was the person. When just from few years, 2 years, he was having no complaints, but from current 2 years, he is having lots of seizures and is getting many attacks, and he is getting it every night, which was become very difficult. And I tell you the fact, in every 15 days at midnight we had to rush to the hospital.
So today I know we are talking about Parth, one of my patients. He's been a patient for the last 10 years, ever since he was in grade 2. Initially his epilepsy was well controlled with anti-seizure medications, but over years he's had a bit of a rocky road with respect to the epilepsy. As time went by, the correct appropriate anti-seizure medications failed to control his epilepsy to the extent that I think since the last few years the seizures became almost every night. So he got investigated further, and we realized that we can actually cure him of his epilepsy, completely get rid of his epilepsy by offering him epilepsy surgery.
Today I would be highlighting a little bit about epilepsy surgery and why is it really needed. It is a very startling fact that 30 to 40% of patients with epilepsy, and since I am a pediatric neurosurgeon, I am talking about children with epilepsy, are actually candidates for epilepsy surgery. So why does a child ever need surgery for epilepsy? That is because there are certain types of epilepsy which will only be cured by surgery. You can continue medications on those children for years together, but those medications, if at all, will only try to control the seizures, but they can never cure the epilepsy. Also, as time goes by, one medication over the other, the family keeps changing doctors, the number of medications increase, but the epilepsy never gets controlled. The other most important thing about children in epilepsy is that childhood, especially the first 7 to 8 years of life, is where all the vital functions like your intelligence, your speech, your memory, all these things are developing. And hence, if a disease like epilepsy, a process like epilepsy hits your brain, this development possibly suffers a permanent setback. Hence, as an epilepsy surgery team, we stress the need for early intervention, and early intervention requires early diagnosis. Therefore, if there is a child who is on more than 2 drugs or multiple drugs, or if there is a child who has had any history of some sort of a damage to the brain in the past, and he is now having epilepsy which is not responding so well to drugs, there is a need to get evaluated by a complex epilepsy team. And if that child seems suitable for epilepsy surgery should be offered to children.
Parth and family were very cooperative. They underwent quite a few tests like video EEG, where I actually get to record and see the seizures that Parth is experiencing at home, do special kinds of MRI brain, some special other scans which are called nuclear medicine scans, such as a PET scan. He underwent a very detailed neuropsychological examination which tells me about how his brain is functioning, and that all led us to the conclusion that his seizures are coming from a very, very small part in the left side of his brain. But that too in the frontal region. So as we know, there are parts to the brain. So this left frontal region is the region which controls speech. So the dilemma with Parth was, yes, if we've identified a region which we can remove and cure him of his epilepsy, but my worry was that is that region also controlling the function of speech?
this area of the brain was in his left brain, and generally in Parth and in most other people, the left brain is the dominant brain. As you know, brain has two sides, two hemispheres. The left brain is the dominant brain, and therefore the speech, our language, our speech is controlled from the dominant brain. So therefore we had a risk that we could possibly go and remove that area of Parth's brain, but there could be a possible damage to speech. Obviously, we counseled the family, we did a lot of testings, including functional MRI, so on and so forth, and we decided that the speech areas were not exactly where we wanted to remove, but they were close to the area where we wanted to operate. Therefore, we had to be very careful. So there are multiple ways of doing this, but the best way or the gold standard is to keep the patient talking while I am operating on his brain. Though it might sound quite scary, but this is the best way to do surgery, because a surgeon feels confident when he can hear the patient talk, give answers whilst he's cutting and operating on that part of the brain.
His eligibility to remain awake and cooperate during surgery was tested by a very dedicated and a specialized team of neuropsychologists. Parth himself was given a lot of time to think whether he could go through the surgery. We gave him a lot of information which helped him to take that decision as to what does it mean to stay awake while your brain is being operated upon. He met with us, with our neurosurgeon, with our neuroanesthetist, apart from being assessed by a neuropsychologist. And the consensus was both by Parth, his family, as well as the team of specialists, that Parth is somebody who will manage to stay awake and cooperate while his brain surgery is ongoing.
I would love to reassure everyone through this medium that with modern neurosurgical techniques, modern equipment, and with a good team in place, doing surgeries in children as young as even 6 months, that is the youngest that we have done in our hospital as of now, good outcomes are possible. Preserving the child and keeping the child as he was before surgery is possible, and cure for epilepsy is possible. Of course, all of that depends on what is the type of epilepsy and what the diagnosis is. Now, I would want to shed some light on the different tools in our armamentarium which makes epilepsy surgery possible, and which in fact, without which epilepsy surgery actually is very difficult or almost close to being impossible. Obviously, all brain surgery, especially pediatric brain surgery, generally needs an operative microscope. It's microneurosurgery. Beyond that, there is a tool which is useful for most surgeries, especially epilepsy surgeries, is something called a neuronavigation. Now, like we have navigation on our mobiles for showing us the way through the city or through different parts of the world, there is a system called neuronavigation which helps a surgeon find his way through the brain. Remember, in many surgeries, but mainly in epilepsy surgery, the brain does not look abnormal. And so therefore, a surgeon needs to know what to do, which part of the brain to touch and which part of the brain to avoid. For this, he needs to know his way through the brain, and this system of neuronavigation at times becomes very, very critical for guiding the surgeon through surgery. And so this is one of the important tools. The other tools that the surgeon uses are tools for testing. Obviously, all of this is done with the help of a neuromonitoring team in the theatres, in the operation theatres, and of course a neurologist who can interpret the findings of testing. But we stimulate parts of the brain to check for function. We have certain instruments which tell us whether we are going close to any vital area of the brain so that we can stop short of going and injuring it. Of course, all of this surgery needs a team, like I said, so it needs a good neurologist. I work with my epileptology colleague, Dr. Pradnya Gadgil, who is in theatre for most cases, who is helping me with the monitoring, who interprets the monitoring, and then we take joint decisions on what kind of surgery to do, how much to remove, how much not to remove, and where not to go. We also obviously have a good neurophysiology team in theatres. We have a dedicated pediatric neuroanesthesia team, which is very, very critical because children are very different from adults, and so therefore especially brain surgeries on children are so critical that when the surgeon is operating on the brain, he needs to be sure that the whole body, the whole system of the child is getting taken care of, and all the red alerts that the surgeon needs to know and the anesthetist needs to know. There needs to be clear communication, and this happens when you have a dedicated team working with you. So a dedicated pediatric neuroanesthesia team is very, very essential, and besides that, of course, a pediatric intensive care unit who will take care of the child after I have operated on him. All of this makes surgery, especially epilepsy surgery, safe in very young infants to children as old as 18 to 19 years as well.
So our neurosurgeon, Dr. Saurav Samantray, removed the part of the brain which was giving rise to seizures while Parth was talking to us during the surgery. Since surgery, remember, Parth would experience seizures every night. So since surgery, he's not experienced any seizures. So he's seizure-free. Of course, it's early days, but so far he's seizure-free. And his speech is entirely unaffected. The post-operative MRI also shows that the part of the brain which we thought is responsible for his seizures has come out entirely. So it's a very, people find it very intriguing, saying how can someone stay awake during their own brain surgery? So this is actually a success of modern techniques of neuroanesthesia, neuropsychology, and of course rock stars like Parth, who willingly sign up and commit themselves and then actually go through the process of the surgery.
However, all of this first of all requires a very, very motivated and courageous patient, and this is all the more difficult in children, young children, adolescents, teenagers as opposed to adults. But Parth was a really motivated child. Parth has been walking around the hospital wards and corridors. He's almost like a mascot of live awake surgery, and he's motivating all other children who are coming for epilepsy surgery here. I am really happy that we could help Parth and his family, and also the good thing is that Parth used to get seizures every day. The family was really worried, and they were really disturbed, multiple hospital admissions because of his seizures. Now it's been 4 days, he's not got a single seizure, though it's early days, but we are optimistic that hopefully this looks like seizure freedom. Of course, time will tell how his his epilepsy is cured or controlled.
And now after the operation, we worried that it was operation, very big surgery. He had gone at 8 o'clock and come after at 6 o'clock. But then after seeing him and being really coming out well, doctor said, and the main thing, Dr. Pradnya said, Parth has cooperated really well. That his cooperation, everything, we could do it. He is cooperated best, and he's the best. That is the best thing that he has done, and that is for his good only. And it's come out really like a victory for him. And everybody has really praised him, and I feel like really proud of my son that he's done it so well. And I must say he's really proud. And because of his Parth's cooperation, Dr. Pradnya, Dr. Saurav, Dr. Urvashi, Dr. Nandinave, he's been fully cured, and I can tell you his body is doing everything on his own now. And after they're going to remove his bandages also, and he's going to take his EEG, and his doctor is going to make him discharge in another few days. We have just been here 4 days, and he's fully sort of recovered. He's doing his own things, and he's managing everything by himself. It's all the credit to these people. I really thank a lot of them.
For me, it's look good actually. How should I say, like, even though it's 2 or 3 days, I don't know how many days it should be, but it's good actually. I'm being discharged, like, even though, but yeah, it's good.
And you have not got the seizures from 3 days.
Yeah,
for which
that's the big thing.
That's the big thing. Big thing.
That's the big deal.